Don't let cyber threats put your hospital at risk. The number of cybersecurity attacks on healthcare organizations is growing, and patient care is on the line. At the Rubrik Healthcare Summit, you'll get actionable insights from thought leaders like John Rigi, the National Advisor for Cybersecurity and Risk at the American Hospital Association, on how to protect your organization from the latest threats. Join the Rubrik Healthcare Summit on September 10th and learn how to prepare for, respond to, and recover from cyber attacks. Register at events.rubrik.com/healthcare. That's events.rubrik.com/healthcare. I'm Drexta Ford, a recovering healthcare CIO and longtime cyber advisor for some of the world's most innovative cybersecurity companies. And now I'm president of Cyber Risk at This Week Health and the 229 Project, where we're dedicated to transforming healthcare one connection at a time. Our interview and action series allows us to catch up with healthcare leaders throughout the industry and hear about the important work they've been focusing on lately. Now, on to the interview. Hey everyone, it's Drex, and I've got Mike from Rubrik with me. Thanks for being on the show today.
Awesome. Thanks for having me, Drex.
Tell me a little bit about your background. You have an interesting, everybody, hey, when you were a little kid, did you think you would grow up to do this? And the answer is always no. And then it's sort of the next question is so what was the route? How did you get it? Tell me your story.
Yeah, great question. So just to level set on what I do now, my day job is I run our healthcare vertical here at Rubrik. Started with Rubrik, fortunately, in the early days in 2016, when we were just a small company and continued to grow. About 18 months ago, based off of where the market was going and based off of the trends from our customers, we said we needed to really build a program and focus solely on healthcare. As a kid, did I think that I was going to be a healthcare go-to-market professional? No, I wanted to play for the Boston Bruins and I wanted to go play for the Red Sox. In college, I actually wanted to be like an investment banker and work on Wall Street, and graduating during the great financial crisis doesn't really lend itself to that type of career, and found an opportunity to work for a really growing tech company at the time, EMC, now Dell, with my roots back to Massachusetts, which is for me where I learned how to support and work with healthcare customers. That's what I focused on early in my career at EMC.
And you're in Boston now.
I sure am.
And
diehard Boston sports fan too.
I know. And I'm just thinking to myself, I can't believe the Bruins don't call you on draft day. You never get the call?
Every single year, I cross my fingers and I sit there waiting for the call. And amazingly, I don't get it. So I just go back to the Thursday night beer league that I've belonged to. So.
I'm with you. I keep waiting for somebody in the NBA to call me too, and it never happened. Tell me what you're focused on right now at Rubrik and what you're excited about. You just went public, I don't know, a year ago, less than a year ago, maybe?
Yeah. Yep.
It's just, you're on fire right now. And I love to see it because you have great tech, you have great approaches to customers, but tell me what you're focused on and what you're excited about.
Sure. Maybe it would help to just give a quick kind of foundation of Rubrik and who we are for those who don't know. So we were founded on the principle that it's not a matter of if, but when an organization will be going through a cyber attack or be compromised in some form or fashion. And ultimately, you're really kind of only as good as your last line of defense. And you've seen it probably in your career, like the amount of money spent on cybersecurity software has grown exponentially over the last 10 to 15 years, yet cyber attacks are still on the rise. I think you referenced in a recent article that talked about the rise in ransomware attacks just in the summer of 2025 alone, with groups like Interlock and Reseda and Quillen, right? And so these bad actors are getting through. And so your ability to go keep clinical systems online, recover quickly, really depends in large part to the backup environment. And we were founded in a world where legacy architecture just wasn't built to answer the critical questions today. Like, is the data even there when a ransomware attack happens? Is the backup infrastructure survived? Understanding what data was compromised. Was there sensitive data in scope? Do you know where the malware is? And how do you know when to actually go recover that data and not reinfect the environment? Where do you recover to? Have you practiced? Have you orchestrated, right? And so this is why we see proliferation of cyber resilience programs across our customers. And that's really what we are. We are a cyber resilience company. We're a software company. We combine zero trust data principles, data protection with cyber recovery and identity resilience. We apply that platform to workloads both on-prem, in the data center, think large scale virtual environments, database environments. One of our specialties is Epic and EHR protection, cloud, SaaS, large unstructured medical imaging workloads, identity I mentioned. And so we take that approach to that last line of defense to make sure that data is there. We give you the insights to be able to recover in a timely manner. So that's sort of Rubrik in a nutshell. What we're focused on as we grow this healthcare vertical is thinking about how do we minimize the amount of downtime associated with an attack. The average downtime we see for a medium-sized hospital is about 18 days. 18.71 days. And that's for like a 2 to 3 hospital system.
I feel like you're really lucky if you're only down for 18 days right now. So many places that I know that are down for 30, 40, still recovering at 40 days.
Seeing potential proposed legislation to say, hey, can you recover in 72 hours? And to get from what you're talking about to there, it seems like a near impossibility, right? And not to mention just what happens in that period of time, right? Like we see a 30% increase in medical errors if an EHR is down. I mean, how many nurses do you know that have started in the last 15 years that know how to use pen and paper?
I can't tell you how many calls I get when there's an incident from friends of mine who are clinicians at those locations who call me sometimes like literally with tears in their eyes about, I don't know what the heck I'm doing. All the way through school, there was always an EHR, and now I'm not sure what to do. And I'm afraid for my license, right? Because I feel like I'm taking some personal risk here. So it has that massive effect, not only with patients and families, but obviously on staff. And burnout's another big issue.
It's pretty remarkable. Our youngest of 4 children is 18 months, and she was born February of last year. And I remember sitting there at night, my wife was sleeping. I actually asked the nurse, she's inputting information into Epic. And I said, like, hey, just curious, like, what would you do if that went down? And she's like, I'm 39. Every single nurse that's younger than me, I don't think would know what to do in this situation. Like I'm probably the youngest person on this floor that knows the procedure and what to do. And I was just thinking in my head, I'm like, that's alarming, right? And you think about how many things, like how reliant these systems are on not just your EHR, but just everything along those lines. And so you asked earlier, what are we focused on? One of the things that we talk a lot about is this concept of minimal viable hospital, right? And what are the core set of critical hospital operations and critical functions that need to be able to operate during these kind of adverse times, and being able to operate them until you get back to normal state. And so for us, we're spending a lot of time like focusing on what are those critical applications, right? Like EHR and EMR, that's an obvious one. But then you think about everything else that's connected, right? Like facilities management, like is your HVAC operational, like employee management, are your employees getting paid? M365, like, do you use that from a communication perspective? I'm sure you do with Teams and email. I mean, the list goes on. Identity and Active Directory being probably one of the most critical. And when that goes down, obviously we know you're losing access to just about everything. And so we partner a lot with organizations that we facilitate this view of what are those critical applications and how do you build out that minimum viable hospital. Places like Healthing Advisors or folks like CDW and Ahead or Accenture, who we partner with really well to help build that out. And
it's a really tough thing to go through. I mean, you've got 400 or 600 applications. The people who use every one of those applications thinks their application is the most important application. So having other folks you can work with to help sort through and prioritize, that's critical to the whole MVH plan.
It is. And obviously we talk a lot with folks from IT, but there's a whole other set of the organization that needs to be involved to talk about prioritization of those apps and quantifying the downtime with those apps and how do we group them together. The last thing on what we're focused on is where we recover to. There's a complete lack of trust when an event's happening. And if we think about being able to deliver the cyber RTO within hours or days, you need to be able to put it into a clean environment. And so we're talking a lot about that with our customers today as to how do you do that? How do you build it up the right way, whether that's in a large hyperscaler like an AWS, Azure, GCP. We have a great partnership with Rackspace where we're building out this as a service almost. And so being able to look at it, and we believe we obviously have a foundational technology that allows you to not only make sure that data is there, but surgically recover the data sets that are needed and know that what you're recovering is clean, and that level of insight and having that insight within seconds is the difference between potentially being down for weeks or months, as you mentioned before. So how do we take our fundamental technology and build the MVH planning process around it? And then how do we look at that recovery process to get back to normal state? So
When you look down the road, say 6 months or 6 months and 2 years, you can give me a couple of benchmarks there. When you look down the road, what's Rubrik look like? What do you think you're focused on over the curvature of the earth?
I wish I could tell that story right now. I mentioned before that I was fortunate at the start of the company back in 2016. I've been able to see the evolution of the organization from disrupting backup and recovery to being a true cyber resilience platform, things that are right now the highest priority. And I think within the next 6 months will continue to be. And then as I look out beyond the next 6 months, couple of years, where I think this is going, there's no doubt that identity recovery has been the hottest topic that we've had, especially this year. I think the stat is 90% of organizations have had identity related events in the last 12 months.
Yeah.
50% experienced in the last 2 years. And you can imagine, with the connected devices, I think it was a 240% increase in non-human identities that are being. So IDPs like Active Directory, Entra ID, they're a tier 0 workload, right?
If you can't get the identities to work, you can't get anything else to work.
Absolutely right. So we started with saying, hey, we can not only protect and back up and recover Active Directory and Entra ID, but then how do we then orchestrate a recovery and automate that recovery and do it in a really granular manner within our Zero Trust platform, so that our recovery, or at least our platform, will survive an attack itself, so that not only if they go after a backup architecture for identity, we'll still be there. And certainly that's critical, especially to go support this minimum viable hospital. What we are transitioning to is this concept of identity resilience. So instead of just responding, how do we look at being more proactive? Things like forensic tracking for kind of high risk changes. For example, like you see GPO modifications. Could that be a sign of an active cyber attack? And how do we go in real time, or as we're protecting that workload, go alert the right folks and tools to do that?
So not only on the actions like a GPO change, but also on the individual too, who might be the network administrator.
That's right.
Yeah.
That's right. And then you look at continuous, like, kind of visibility and misconfiguration. So are there misconfigurations that happen? We remediate that quickly. And so this is all brand new. I'll do a little shameless plug. We've got a healthcare summit coming up September 10th. We've got a lot of really great speakers, including, I think that you're having a great conversation with Mac Marlowe.
I am. That's great. Yeah, no, it's awesome.
We'll get into detail. Our chief business officer, Mike Tornicasa, who's really one of the visionaries for this cyber recovery, cyber resilience space. That's one. And then if I look even further out, like, we wouldn't be a software company if we didn't talk about AI, right, Drax?
It couldn't be a podcast if we didn't.
I know, right? The great thing about working for a modern software is that we've been leveraging AI for years, right? It's been embedded into how our kind of data threat engine and what we do and how we look at data on a daily basis. But I also think just larger scale, I'd love to get your opinion on this. I heard a talk from the CEO of Innova, Dr. Stephen Jones, I believe it is, a couple months ago, talking about kind of the crisis that we may see here in the future with aging population, turnover of clinicians, not enough nurses and PCPs, and just looking at this gap and how do we bridge that gap. And AI use cases being probably the most critical thing that's going to help us grow through this challenging piece. And probably the challenge with AI is that, especially in healthcare, is the lack of resources and maybe expertise, the sensitivity of the data, obviously, and who has access to it and what they're doing. And so we've always thought about, hey, this is backup. We have old data in an organization. How can we go deliver more value out of that data? So earlier last year, we announced this product called Annapurna. And Annapurna is the concept of being able to access multiple data sources that are protected and already stored within Rubrik to deliver and accelerate Gen AI use cases. That concept of, do we really need to move that data? Could we leverage this platform as a data lake itself, but
interesting,
with the security and the governance already baked in across the lifecycle of that AI app? So thinking a little bit about that, we just acquired a company called Fredrickson, which is in this space. Their platform is all about building, tuning, and customizing new AI models. And then you tie those things together. Literally today, we announced this concept of agent rewind, where if we can combine the visibility of looking at all these AI agents across an organization with the recovery capabilities of Rubrik, can we help reverse actions that may have had unintended consequences?
I love this. So this is like change control
Yeah.
for AI agents. So if I was talking to somebody about this earlier today, sorry, you've hit on something good here. It's exciting to think about. We're replacing some capabilities in cybersecurity today, like lower level boring, got to go through a bunch of stuff. We're using agents to sort of replace some of that labor so that the people can go do the actual complicated, more hard stuff. But then there's the challenge of at some point you want to give the agent the power to be able to actually take an action. But everybody's scared about that because once you take an action, oh my gosh, it's done. What if the agent makes a mistake?
Right.
You got a way around that now.
Right. This concept of agent rewind. And I think it makes sense, especially with what we do and what we've been good at recovery for our existence as a company, and being able to recover, especially if there's unintended consequences that come from changes or something that we didn't want that agent to do. So a lot more to come on it. By no means am I an expert in this topic, but certainly a big part of what we'll talk about in this upcoming summit, and then really around the roadmap of where we're bringing this organization.
That's exciting. I want to ask you one more question. This is the one that is, I don't think it's a gotcha question. It's just a really interesting question I think we all struggle with. So every healthcare IT leader hates being sold to, right? But we're also in this world where nothing happens without partners. Nobody can do all this stuff on their own. You need to have these great partnerships to get the job done. Tell me about the culture you're building at Rubrik that helps make that teamwork, don't feel like I'm being sold to all the time. Tell me about the culture you're building to make that a reality.
Yeah, that's a great question. Yeah, and part of my org is a team of, we've got 25 account executives across the US supporting the largest health systems in the country. Drex, have you heard the concept of seller's deficit disorder by chance?
Tell me.
So we talk about it a lot at Rubrik, not just in healthcare, but it's this notion that kind of most buyers have a really negative connotation of salespeople. And it's really based off of past experiences where they felt, like you said, they're being sold to, they don't understand their business, they don't listen to their needs. And there's all kinds of issues that come from it. Everything that we do is to try to make that a misconception, especially working with us. And we try to, from just what we require is we do a lot of homework. We try to understand the market. We try to understand the population that our health systems are serving and the financials, what's the payer mix. So we understand sort of what are the constraints that are going on, the clinical services that are offered. Like, we try to really understand the business and what our customers are going through. And then you met Josh Howell, who's our healthcare field CTO.
Yeah.
He spends a lot of time educating our team on just healthcare in general and the system and how it works, the macro trends that are impacting kind of the stability of the system, specific applications that are consistent, whether you're a rural hospital or an AMC or a children's hospital, for-profit, not-for-profit, you get it. Like, we want to make sure that our team really understands the business. And so it's really teaching empathy in a lot of ways. So to make sure they understand like the conundrum and the pain that most healthcare IT folks go through right now. I start my team call with the same mission statement for my team. And it's about, we want to empower all health systems to quickly recover and safeguard patient data, deliver uninterrupted patient care, and uphold resiliency in the face of cyber threats. And that's what I want my team to think about, because it's customer first. It's not about, Rubrik and our product and selling it. I think this manifests itself in a couple different ways, but one of them is, like, just recently we had to re-educate our team on a lot of the financial problems or trends that are negatively impacting all of our customers. Everything from changes in payer mix to reimbursement rates to higher costs of care and labor shortages, regulatory impacts. And so it's harder and harder for our customers to go justify, like, how do you go sell new software into that environment? Like, it's hard to do that. And if it's hard for us, it's really hard for our customers. And so we try to partner with them and give them the tools to go justify. How do we go consolidate multiple different technologies into a single platform to drive cost savings? And we show a 25 to 30% lower TCO with this platform. Josh has built an impact calculator that I think is maybe the best and most detailed view of what the cost of a ransomware event would be. And we can actually mirror that with, hey, what does this look like if Rubrik was in place?
He showed me that and I'm in love with it. I have a little crush on that.
It's incredible. And I think we've vetted that out with chief risk officers, chief financial officers, who actually tell us that we're light. Like, hey, we're showing you $165 million impact, both short-term and long-term, to this potential event. And they say, hey, our calculations might be 10 to 15% more than that, or whatever that might be. We're not trying to oversell or anything like that. We just want to arm our partners within these organizations with the tools that they need to go stand up to the CFO or CEO or board of director. And so that's kind of the culture we're trying to build, is put our team in the shoes of healthcare IT professionals. And if that's ever not the case, if anyone's listening and that's ever not the case for my team, please call me, please send me a message, because that's how we want to operate. So
I like it. It's starting the meeting with the mission statement, and the mission statement for you isn't about the tech, and it's not about selling the tech. It's about solving the problem for the customer. And you actually punch that mission statement all the way through to patients and families, which that is the deal that we're involved in.
Yeah. Yeah. Well, and we appreciate partnering with folks like you and This Week Health and being a part of these 229 events and the city dinners, because we end up learning so much. There's a lot of folks at Rubrik that want to be involved and learn, and we bring a lot of those learnings back to our team, our product team, our partnership teams, to try to make sure we're doing better for our customers. And I think that's what it's all about, is to facilitate that learning and continue to get better. So
yeah. Mike, thanks for being on the show today. I really appreciate it. Hope our paths cross soon on the road somewhere.
I hope so as well. Thanks, Drex.
Thanks for listening to this interview in action episode. If you found value in it, share it with a peer. It's a great chance to discuss the issues and, in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, that'd be great. Thanks for listening. That's all for now.